Imagine waking up just completely drenched in sweat. Your heart is pounding against your ribs, and you are completely convinced, like absolutely certain you're having a panic attack.
Yeah, it's terrifying.
Right. And imagine this happening every single night for, 12 years.
Ah.
And then imagine sitting in a doctor's office, just totally exhausted, only to be told it's just a quick phase and you simply need to tough it out.
Which is just, I mean, it's incredibly dismissive.
Exactly. So, welcome, learner, to today's deep dive. Our mission today is to completely dismantle one of the most pervasive, just wildly dismissive medical myths surrounding the menopause transition. We are answering a highly specific but massively impactful question. How long do hot flushes and night sweats actually typically last?
It is a question that for generations was answered with, a pat on the back and a wildly inaccurate timeline.
Right, like, oh, it'll pass.
Exactly. Women were told to expect maybe a few months of discomfort or like a couple of years at the absolute most.
Which is mind-boggling when we actually look at the data we've stacked up for this deep dive. I mean, we are unpacking clinical guidelines from the British Menopause Society, the National Institute for Health and Care Excellence, known as NICE, as well as insights from the Menopause Society.
All really solid sources.
Yeah, but the real heavy hitter today, the one that changes everything, is the groundbreaking observational data from the SWAN study. That stands for the Study of Women's Health Across the Nation.
The SWAN study is, it's a phenomenal data set because it's fundamentally rewrote the medical consensus on this. I mean, it proved that we are not talking about a fleeting symptom that you just grit your teeth and push through.
No, not at all.
We are talking about a physical reality that can and does dominate a full decade of a person's life.
A full decade. And to really grasp how a single symptom can hijack 10 years of your life, we kind of have to start at the source, right? But before we can even talk about the timeline, we need to understand the mechanism.
Right. What's actually happening in the body?
Because the clinical term used across all our sources isn't actually hot flushes, it's vasomotor symptoms, or VMS.
Yes, vasomotor symptoms. And this umbrella term covers both hot flushes, which, occur during the day, and night sweats, which were literally the exact same physiological event, just happening while you were asleep.
And the prevalence is just staggering.
It really is. Up to 80% of women will experience VMS during the menopause transition.
80%. And the sources point out that for a full 25% of women, these symptoms aren't just a mild inconvenience, right? They are severe. They're debilitating.
Yeah, they completely disrupt daily life.
We need to be clear about what this physical reality looks like for the learner. A hot flush is a sudden, just intense sensation of heat that usually starts in the upper body, like the face, the neck, the chest.
And it comes on fast.
Super fast. It lasts anywhere from 1 to 5 minutes on average, though some women report them dragging on for like up to an hour.
Which sounds agonizing.
And it brings rapid heartbeat, profound sweating, and a very real feeling of intense anxiety.
And crucially, this massive wave of heat is frequently followed by a profound chill.
Oh, right, the shivering.
Yeah, you are radiating heat, you're sweating through your clothes, and then immediately you're shivering. And to understand why this happens, we actually have to look at the brain.
The brain. Not the hormones directly.
Or specifically the hypothalamus, which acts as the body's internal temperature regulating center. So inside the hypothalamus is a specific group of neurons known as KNDI neurons.
Wait, let me stop you there because the sources throw that term around a lot. What exactly is a KNDI neuron? Is it spelled like the sweet?
Well, it's spelled KNDIY, but yeah, pronounced like candy. So basically, they act as the brain's thermostat. The name KNDI is an acronym for the specific neurotransmitters they use to communicate, but, for our purposes, the most important one to remember is neurokinin B.
Neurokinin B. Okay.
Right. Think of neurokinin B as the chemical signal that tells your body, like, hey, we are overheating. During a woman's reproductive years, her natural endogenous estrogen essentially acts as the brakes on these neurons.
So estrogen keeps the thermostat stable.
Precisely. It keeps everything running smoothly.
But as you enter the menopause transition, those natural estrogen levels begin to, fluctuate wildly, and eventually they just drop.
Yeah, the brakes fail. Without that steady supply of estrogen, the hypothalamus becomes hypersensitive. Your thermoregulatory neutral zone, which is the narrow window of temperature where your body feels comfortable, it just shrinks drastically.
So the window gets tiny.
Exactly. So a tiny, completely imperceptible change in core body temperature suddenly triggers this massive alarm in the brain.
Okay, I want to make sure I'm visualizing this correctly for the listener. It's essentially like having a broken thermostat in your house, right?
That's a great way to put it.
Like, the room is a perfectly normal 70 degrees, but the broken thermostat misreads the room and thinks it's 100 degrees.
But it panics.
It panics and triggers an emergency response. The blood vessels in your skin rapidly dilate to dump all this non-existent excess heat, and that is the severe flushing and the sweating.
Yes, that's the physical flush.
But because you didn't actually need to cool down, the thermostat immediately overcorrects, blasting the AC, which causes that intense post-flush chill.
That is exactly what is happening on a vascular level.
hmm
The brain is initiating a massive heat dissipation response to a threat that just doesn't exist.
Wow.
And this is the most vital takeaway for you, the listener, if you or someone you love is dealing with this. This is not a psychological response to getting older.
It's not just all in your head.
No, it is a direct, measurable, neurological misfiring caused by estrogen withdrawal.
Okay, but wait. I'm stuck on something here. If the KNDI neurons are just reacting to the drop in estrogen, why wouldn't they eventually just get used to the new lower estrogen level? Like, why wouldn't the brain just adapt and stabilize after a few months?
See, that is the exact assumption the medical community operated on for decades.
Really? They just assumed it would fix itself.
Yeah, they assumed the brain would quickly recalibrate. But the brain's neural pathways are incredibly complex, and the KND neurons are stubbornly wired to expect that estrogen inhibition. It takes a remarkably long time for the hypothalamus to establish a new baseline.
Which brings us to the actual data on how long this recalibration takes.
All right, let's get into the SWAN study, because
Yeah.
this is where that old 6 months to 2 years clinical guideline gets absolutely obliterated.
Yeah, obliterate is the right word.
The beauty of the SWAN study is its methodology. It didn't just ask women to, try to remember their symptoms after the fact. It prospectively tracked 1,449 women with frequent VMS over multiple years.
Across various racial and ethnic groups too, right?
Exactly. And when they calculated the total duration of frequent hot flushes and night sweats, the median duration was 7.4 years.
7.4 years. I mean, let that sink in. And that is just the median, meaning half the women tracked experienced them for even longer than that.
Correct. But the SWAN data went further and revealed something called the onset timing rule. And this is crucial. When your symptoms first begin, completely dictates how long you will be stuck with them.
Okay, so if you are listening to this right now, learner, and you are in your early 40s, you're still having regular periods, but you're starting to wake up with night sweats, you need to pay close attention to this next data point.
Because your timeline looks very different than someone whose symptoms start later.
It's a drastic difference, isn't it?
It is. The data shows that if a woman's hot flushes start post-menopause, meaning they only begin after she has already gone a full 12 months without a period, she will actually have the shortest duration of symptoms.
And what's the median for that group?
The median there is 3.4 years.
Which is still almost double the old 2-year myth.
Right.
But what about the women who start getting hot flushes while they are still having their periods?
Oh, they endure the longest timeline by far. Women who are premenopausal or in early perimenopause when they first report frequent VMS face a median symptom duration of greater than 11.8 years.
Wait, over 11.8 years of a broken thermostat?
Yes.
That is just devastating. How on earth did the medical establishment get away with telling women this was a quick passing phase for so long? Where did that bad data even come from?
It was a massive failure in how the older studies were designed. Older clinical trials almost exclusively looked at women who were already fully postmenopausal.
Oh, so they just ignored the perimenopause transition entirely.
Entirely. So by the time those old studies started the clock, the women had already been having symptoms for 5, 6, or 7 years. They were only measuring the tail end of the suffering.
That is unbelievable.
The SWAN study finally caught the symptoms at their actual beginning.
It is honestly, it's infuriating to think about how much medical gaslighting happens simply because researchers weren't starting the clock early enough.
Definitely. And even after the final menstrual period, which is the definitive marker of menopause, the SWAN study shows symptoms persist for a median of 4.5 years.
And the British Menopause Society even notes that for about 10% of women, these vasomotor symptoms can last for 12 to 20 years.
Which brings up a vital question. If 7.4 years is the average, the median, what is happening inside the bodies of that 10% who suffer for 2 decades?
Right. What pushes someone to the absolute extreme end of this timeline?
The sources break this down into a few distinct categories: demographic disparities, physical amplifiers and psychological amplifiers.
Let's look at the global and demographic picture first. The SWAN study found huge racial disparities in the U.S., didn't it?
It did. African American women reported the longest duration of vasomotor symptoms, with a median of 10.1 years.
And on a global scale, the International Menopause Society notes that up to 74% of European women suffer hot flushes, but in Asia, the prevalence drops dramatically to between 22 and 63%.
We have to ask why those disparities exist. It is a highly complex web.
So what's driving the lower prevalence in Asian cultures?
Researchers point heavily to diet, specifically diets rich in phytoestrogens, like soy.
Phytoestrogens, what do those do exactly?
Well, they're plant-based compounds that can actually mimic estrogen in the body. They dock into the body's estrogen receptors and provide a tiny bit of weak stabilizing inhibition to the hypothalamus.
Oh, wow. So it's essentially nature's microdose of hormone therapy.
That's a really good way to think of it.
That is fascinating. So diet can literally trick the hypothalamus into staying calmer. But zooming in from the global scale to the individual, what physical factors make one woman's thermostat glitch worse than someone else's?
Adipose tissue, or body fat, is a major factor. Higher abdominal fat significantly amplifies the risk, particularly in younger women entering the transition.
Why does belly fat make it worse?
Because adipose tissue actually metabolizes and stores estrogen. If you have higher body fat, your estrogen levels can fluctuate much more radically. It creates a roller coaster effect that confuses the hypothalamus even more than a steady, predictable drop would.
Ah, that makes sense. And the SWAN study also highlights smoking as a massive amplifier.
Yes, current and past cigarette smoking significantly increases the duration of hot flushes.
Which makes total sense when you remember that a hot flush is fundamentally a vascular event. Like if smoking has damaged your blood vessels, making them less elastic and harder to dilate smoothly, the body's heat dissipation response is going to be much more chaotic.
Exactly, the hardware is damaged. But perhaps the most profound amplifiers found in the SWAN data are the psychological ones.
Tell me about those.
They found that lower educational levels, higher symptom sensitivity, and crucially higher levels of depression and anxiety at the first report of VMS are directly linked to longer-lasting physical symptoms.
The psychological piece is huge, but I want to clarify how this works. I mean, if I haven't slept properly in 5 years because I wake up drenched in sweat every night, of course I'm going to be depressed and anxious. The physical symptoms are obviously causing the psychological distress, right?
That is absolutely true. The sleep disruption degrades cognitive function and mood, but the mechanism works in the other direction too. The medical term for this is allostatic load.
Whoa, allostatic load. Okay, what does that actually mean for the person experiencing it?
Think of your nervous system as a bucket. Every stressor in your life, like financial anxiety, trauma, chronic depression, pours water into that bucket.
Okay, I'm with you.
If you enter the menopause transition with a bucket that is already overflowing, your nervous system has zero capacity left to absorb the shock of estrogen withdrawal.
Because you're already maxed out.
Right. Chronic stress floods the body with cortisol and adrenaline, which literally alters your neurochemistry. Those stress hormones make the hypothalamus even more sensitive to temperature.
So the overflowing stress bucket makes the physical hot flushes worse, and then the severe hot flushes pour more anxiety back into the bucket.
It is a brutal bidirectional feedback loop.
And knowing that this loop can easily last 11.8 years, we have to look at how to break it. What tools do our sources give the listener to actually fight back and reset this broken thermostat?
The clinical guidelines from NICE and the British Menopause Society are very definitive on this point. The gold standard, the absolute most effective treatment for vasomotor symptoms, is hormone replacement therapy, or HRT.
Because it goes straight to the root cause. It gives those KNDD neurons the exact stabilizing estrogen they are just screaming for.
Yes, you are reinstalling the brakes. The data is clear. HRT resolves up to 90% of vasomotor symptoms within 3 months.
90%.
Yeah, for the vast majority of women, it provides profound, rapid relief.
But we know HRT is not an option for everyone. The sources specifically highlight breast cancer survivors, particularly those on estrogen-lowering drugs like tamoxifen. And tamoxifen actually triggers severe flushing, doesn't it?
It does, unfortunately. Tamoxifen actively blocks estrogen receptors in the body to prevent cancer cells from growing. But by doing so, it artificially starves the hypothalamus of whatever trace estrogen might still be there.
Causing incredibly intense VMS.
Exactly. So for these women, and really anyone who cannot take HRT, There are highly effective non-hormonal options. Certain SSRIs and SNRIs have up to a 60% success rate in reducing symptom severity.
Wait, SSRIs? Those are traditionally used as antidepressants. How does a drug meant for depression fix a broken temperature thermostat in the brain?
It is a great question. Serotonin is often thought of purely as a mood hormone, but it also acts as a critical messenger in the hypothalamus. Boosting serotonin levels helps to artificially widen that narrowed thermoregulatory neutral zone.
Oh, so it essentially gives the thermostat a little more wiggle room before it panics.
Exactly, it raises the threshold.
That is incredible. And the sources also mention medications like gabapentin, clonidine, and a relatively new targeted therapy called fezolinetant.
Fezolinetant is a massive breakthrough because it specifically targets the mechanism we discussed earlier. It is a neurokinin B antagonist.
So it blocks the KNDI neurons directly.
Right, it directly blocks that specific chemical alarm signal in the KNDI neurons, stopping the flush at the neurological source without using any hormones.
So the pharmacology is advancing rapidly. But beyond medications, the sources spend a significant amount of time on lifestyle interventions.
They do. Now, lifestyle changes are unlikely to completely eliminate the symptoms, right?
Mm.
But they are powerful tools for raising the threshold at which a flush is triggered.
It is about avoiding the environmental tipping points.
Exactly. The consensus is to limit caffeine, alcohol, spicy foods, and hot drinks, especially right before bed. You want to maintain a cool bedroom environment, use layered, breathable, natural fibers instead of synthetic materials, and, work to maintain stable blood sugar.
There was also a really fascinating 2024 study published in Post-Reproductive Health that looked at cold exposure, specifically women who took up cold water swimming in the ocean or unheated pools.
Yeah, the results of that study were striking. Among the cold water swimmers, 30% reported a reduction in hot flushes, and 20% saw a significant decrease in night sweats.
How does jumping into freezing water actually stop a hot flush, though? Like biologically?
It comes down to vascular training. When you plunge into cold water, your blood vessels are forced to undergo massive, rapid constriction, followed by dilation when you warm up again.
So it's like a workout for your veins.
Basically, yeah. Doing this regularly exercises the smooth muscle in the vascular system. It trains the blood vessels to operate more efficiently, which makes the erratic flushing response of VMS much less severe.
That makes so much sense.
And furthermore, the massive endorphin rush of surviving the cold water acts to essentially empty that stress bucket we talked about, lowering the overall allostatic load.
Okay, to synthesize all of these treatment paths, let's go back to our house analogy. If your body is the house, taking HRT or fezolinetant is like going into the drywall, finding the broken thermostat, and rewiring it so it stops misfiring.
You are fixing the root cause.
Right. Whereas lifestyle changes, like avoiding spicy food, turning down the heat, or taking a daily cold swim, are more like putting a high-powered fan in the room. One strategy repairs the mechanism, while the other manages the environment so the broken mechanism doesn't destroy your quality of life.
That is a perfect summation. You manage the environment, you repair the thermostat, or ideally, you combine both approaches to support your long-term health.
So, bringing all of this data together, what is the ultimate takeaway for you, the learner? If you are experiencing hot flushes or night sweats, the most important thing you can realize today is that you are dealing with a measurable neurological event.
Yes, your hypothalamus is misfiring.
You are not crazy, and it is not a character flaw if you cannot just power through it.
And statistically, you are looking at a timeline that is much, much longer than society has historically admitted. A median duration of 7.4 years, and potentially over a decade, if your symptoms started while you were still having regular periods.
The advice to just tough it out for a few months is biologically false. It is medical gaslighting that ignores the massive impact these symptoms have on your life. You do not have to suffer in silence because highly effective treatments exist right now to help you reclaim those years.
And there's one final critical piece of data hidden in these sources that you need to be aware of. It comes from the Swan Heart Study, and it frames this entire conversation in a completely new light.
Wait, what did they find?
Well, we established today that a hot flush is fundamentally a vascular event. Your blood vessels are rapidly, violently dilating and constricting. The Swan Heart Study showed a direct link between frequent hot flushes and subclinical cardiovascular disease.
Subclinical, meaning like damage that is happening beneath the surface before a patient actually feels sick.
Exactly. It raises a really profound question. If your blood vessels are acting erratically, constantly undergoing this maladaptive stress test for a decade or more, What is the long-term wear and tear on your vascular system?
Oh, wow.
Could a severe decade-long history of hot flushes actually be an early warning system?
That changes everything. Instead of just viewing a hot flush as an annoying symptom that ruins your sleep, it might literally be a window into the future of your heart health.
Precisely. It strongly suggests that the duration and severity of your hot flushes isn't just something you should discuss with your gynecologist to get better sleep today.
Oh.
It is vital medical history that you should be discussing with your cardiologist to protect your heart tomorrow.
It's like finding out that the broken thermostat isn't just making the living room uncomfortable. The erratic temperature swings are actually cracking the foundation of the house.
Exactly.
That is a staggering thought to leave on. Keep questioning those old timelines, learner. Keep advocating for your comfort, and we will catch you on the next deep dive.